Hello cruel world, my name is Dr. Sohom Das, I'm a Consultant Forensic Psychiatrist. This video is about how we, as in members of staff and me specifically, deal with violent or aggressive patients in hospital. I have already done a video about violent defendants in courts and prisons that I see, so go check that out. Treating patients in hospital is very different because they're there for the long haul, long-term rehabilitation. I should point out that the vast majority of psychiatric patients are not violent, and I don't want to suggest that they are, but as a forensic psychiatrist, I specifically deal with patients who are violent, or at least have a history of violence. So the first thing I would say is that in the world of forensic psychiatry, we're very kind of clued up and we're used to dealing with risk. So when a patient comes through our door, it's very rare that they're an unknown entity. We've usually done our homework, so there's already been a thorough risk assessment and they're placed in an appropriate level of security. So there's low, medium, high secure units like Broadmoor, and even within those units there's different kind of stratified layers of how risky patients are within that unit. So for example, that would affect the proportion of staff members there, the number of patients would be lesser in a unit where you're expecting more agitated patients. One way that we contain the risk of violence is we observe patients. If a patient is very risky, then they might be on a 1-to-1 OBS or even 2-to-1 OBS, which means that either 1 or 2 nurses follow them around 24 hours a day, just keeping an eye on them. Obviously, this is very resource heavy, and that means that 1 or 2 nurses have been pulled away from other duties, such as rehabilitating the other patients. So we try and keep this to a minimum. The other thing is that we all carry alarms. So if there's ever somebody who feels they're at risk or is actually physically being assaulted, they would press their alarm and there would be an emergency response team. So there would be an alarm that would go all around the hospital, and nurses who are specifically part of that team for that shift would be alerted of where the emergency is, and they'll all come bundling in within hopefully a minute or 2. Also, I should mention that every single doctor and nurse, and in fact every frontline staff member in forensic units, are trained in de-escalation techniques and also control and restraint. So specifically how to physically hold somebody and restrain them. Even though everybody's trained, the vast majority of the times it's the nurses that have to deal with aggression. And the other thing I should point out is that despite what you might see on TV programs like One Flew Over the Cuckoo's Nest, the people that do the restraint, the nurses, are not big, beefy, burly, like bodybuilders. A lot of alliteration there. They come in all shapes and sizes, and at the risk of coming across as rude, I have to say that some of them are quite elderly, some of them don't look particularly athletic. I'm just saying. Another key area to contain violence and aggression in the world of forensic psychiatry is the dreaded seclusion room. So this is kind of what you might think of as a padded cell. So it's for patients who are deemed so dangerous that they can't be maintained on the ward because of the danger to staff members and to other patients, so they're locked in a seclusion room. Usually this is for a matter of days, occasionally it might be weeks, it's rarely longer than that. And even though they're locked in there, they still have a level of support and treatment. So nurses and doctors go in on a regular basis to give the patient medication, food obviously, to check that they're physically well, for example, blood pressure, pulse, if it's safe to do so. There's lots of safety measures within the seclusion room. So for example, there's no furniture, there's nothing that can be picked up and weaponized. There is one big mattress for the patients to sleep on, but it's kind of vinyl, huge blue, untearable, you can't really pick it up. And for example, there's a bathroom, but there's no bits that you can rip off and use to stab somebody. So for example, there isn't a glass mirror, but it is like a big metal sheet that can't be pulled off. So obviously these are short-term fixes to the immediacy of violence, but the patients are there in forensic units especially to deal with their mental illness and to try and decrease the violence in the future. And there's a few ways we do that. One of the most important ways is to medicate their illness. So if they've got psychosis, you give them antipsychotics. If they've got something like bipolar, which has led to mania, you give them mood stabilizers. And after their mental state has settled, which to be fair, might take a couple of months to get the right medication at the right level, right doses versus side effects, etc. After all that is done, you do some psychotherapy with the patient. So you try and help them gather some insight into where this violence has come from. So is it related to, for example, previous traumas, lashing out at an abusive parent from years ago, for example, or if it's come from a reaction to more recent events. And we also help the patient develop insight into their symptoms, hopefully to help them recognize when they're becoming ill again in the future. And this therapy is done by psychologists as opposed to psychiatrists. There are many differences. Don't have time to go into it all now, so just trust me, but that is a separate video right there. And I would say that broadly speaking, all of these measures do tend to work. Some patients, it takes longer than others, but eventually most patients move on and are discharged into the community. The level of success depends on the environment, so low secure units obviously have a higher turnover and a higher level of success of discharging patients than a high secure unit. I worked at Broadmoor as a specialist registrar, and I worked in the high dependency unit, so that had the most disturbed patients within the forensic psychiatric system. So unsurprisingly, many of those patients probably wouldn't move on. They might not be discharged for years or decades. Some of them will almost certainly spend all their lives in hospital, which obviously is tragic. So to answer a specific question which inspired me to make these videos, this was by Joanne Dawson. The question was, are straitjackets or other kinds of physical restraints used in high secure units? And the answer is no. Although patients are physically restrained by staff occasionally if they're kicking off, on a day-to-day basis, straitjackets, handcuffs, physical restraints are not used in high secure units in the UK. It's different in other countries, so for example, they do use that in exceptional circumstances in France. Within the world of forensic psychiatry, or in French, le monde de la psychiatrique forensique. Possibly, I just made that up. So before I leave you, I just want to formally welcome you to this channel, A Psych for Sore Minds. I'm a consultant forensic psychiatrist and I work in London. I assess mentally disordered offenders, so you don't have to. This channel is like a crossroads between true crime and mental illness. I talk about a whole range of issues, some of which are related to violence and aggression, like this one, and some of which are more familiar topics to the average person. I do all kinds of different videos really. Sometimes I interview ex-patients, sometimes I talk about specific diagnoses, sometimes I assess high-profile cases where the perpetrator has got a mental illness. Just basically what I'm saying is there's something for everybody on this channel. My USP, I think, is that I talk about my real life cases in depth to educate you. Obviously, I anonymise them out of respect for the patient. So it really helped me out if you subscribe. Not only will it help me out immeasurably, but it will actually mean that your own mother will love you more. Just your mother though, not your dad. He still thinks you're a right and utter